Well, a superbug outbreak at a California medical center has left at least 2 people dead and a teenager fighting for his life. The drug-resistant bacteria is being linked to contaminated equipment at the facility, and now the warning that about 170 other patients may have been exposed. Dr. David Samadi is chair of urology at Lenox Hill Hospital and a Fox News contributor as well. Dr. Samadi, this is a lot of folks' worst fear. You go into the hospital for something that shouldn't cause you to lose your life, and you come out sicker than you went in. How does this happen?
Well, unfortunately, we're starting to see more and more of these, what we call superbugs. They're extremely resistant to the antibiotics that we have, and we've been talking about them more and more in all of these medical segments. The way that it works is that because we've been using our antibiotics for so many years, the bugs are now getting smarter, and they're getting basically immune to our antibiotics. We haven't been really investing a lot of money and research on new antibiotics, so we're kind of running out of these, and the bugs are getting more and more resistant, and it's a huge problem.
We have invested. I mean, you see this huge market for cleaning supplies, right? Sanitation. It's such a big industry. It must be a huge industry inside the hospital, and the suggestion is that some of this equipment being used just wasn't clean.
Well, let me just say that, I don't want to start a big fear that, if you go to the hospital, we're still taking care of millions and millions of patients. 170, even though it's not a big number, it's still a big concern. And these superbugs, Jenna, we're going to be talking more because it's not going to stop here. This Carbapenem enterobacterus is a real serious problem, and we're seeing more and more as contamination with stool, with urine. In this particular case, it was a scope that was contaminated. So every surgery center, every hospital should really go way out of their way to make sure that these equipments are sterilized, really clean, and so we don't have these kind of cases. Some of it is completely unavoidable. It doesn't matter what you do, these bugs can't survive for a long time, and unfortunately, something that we have to deal with.
It's definitely scary to think about. I want to ask you about this other news story. There's a new government report that's urging us to really think about the environment when we're making food choices and thinking about more plant-based food choices versus the hamburger out there. Dr. Samadi, what do you think about that part of that philosophy in how we choose our food?
We've always talked about the Mediterranean diet, and I think it's basically common sense at this point. Look, I think if you have once in a while a burger, it's not going to really hurt you. So moderation is the key word. But sticking to plant-based diet is absolutely the way to go. Fruits and vegetables, 3 servings a day, is what we've always recommended.
So you're saying the motivation, whether it's the environment or otherwise, it just
look, I'm not into this whole global warming. Today I was talking about global freezing. It's like, so I'm not into if we have plant versus having like cows out there, it's going to change any of the environment stuff. And I'm sure I'm going to get a lot of emails about this. But I think for your health, which is what I am as a doctor, sticking to all of those plant-based foods is absolutely the way to go. Reduce the inflammation, reduces the colon cancer, and everything else that you already know. So I'm all about that. And don't forget about what? Your coffee. Coffee we've been talking about a lot, and that's what I'm sure.
One of the dietary recommendations as well was several cups of coffee, or really to embrace coffee drinking. Unfortunately, we can't get to that, doctor, because we have to go to commercial break, but it's nice to
I'll put it on my Twitter for you.
Yes, we'll look for it on your Twitter account. He always posts fun pictures as well. John and I got that experience last week, didn't we, John?
That's right.